Welcome to Hope for Med. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Amy Comander. Dr. Comander is Director of Breast Oncology and Survivorship at the Mass General Cancer Center in Waltham and Newton-Wellesley Hospital. She is board certified in hematology and medical oncology, as well as in lifestyle medicine. Welcome to the show, Dr. Comander.
Thank you so much for that kind introduction. It's great to be here.
So, Dr. Comander, let us start from the beginning. Can you share with my listener your origin story?
Thank you again for inviting me. Wow. Well, that's a big question, but happy to. So, as you noted, I live up here in New England and in Boston, Massachusetts, and I did not grow up as a New Englander. I actually grew up in the South. In Georgia. I grew up in Savannah, Georgia. We ended up there. My dad was in the Army, and that's how I ended up living there from age 5 through until high school. And then when I graduated from high school, I was ready for a change. I just wanted to live in a different place and experience a different part of the country and just be exposed to different kinds of people. So I ended up here in Massachusetts, actually right out of high school. I was an undergrad at Harvard, and I got to experience New England winters for the first time, which definitely was tough because I think in those years we had some of the record snowfalls, which was crazy to experience that. But certainly I loved the opportunity to be here in Massachusetts for college. And I've always really been interested in science and medicine. When I was an undergrad, I was really passionate about neuroscience. If you talk to anyone who knew me back in the day, yeah, I was a geek when it came to neuroscience and psychology and cognitive science. And I thought that's what I would do. I'd become a neuroscientist one day. But we know that the things we think about when we're younger may not always turn out to be the case. So I ended up taking a lot of those classes and truly loved it. But when I did end up in medical school, I ended up realizing I had many other passions that I really enjoyed learning about the entire human body and internal medicine and how to care for the whole patient. And so I realized I truly loved internal medicine, caring for adults, and then eventually got really interested in the field of oncology. And that's how I ended up where I am. That's a quick summary.
Wow. And so did you have a neurorotation and you realized, well, I want to do more than just focus on the brain? Or what exactly happened that made you decide
It's such an
oncology?
interesting question because I'm sure as you could relate as well, we have all these ideas of what we're fascinated about and passionate about. And sometimes, though, when you actually get to experience, for example, what is it like to be a neurologist or a psychiatrist, maybe you realize that wasn't the path that was really meant for you. So
Mm-hmm.
I'm still fascinated by neuroscience research and psychiatry research. And I find myself drawn to reading about those disorders and how we can treat them. I'm still super interested in that. But it's true, when I did my neurology rotation and psychiatry rotations in medical school, I found that it wasn't exactly what I was looking for. Like, I really found it fascinating to learn how to care for those patients with those various disorders, but realized that I did miss caring for, I'm going to say again, the whole patient, like really understanding what's going on with the cardiovascular system, endocrine system, lungs, brain, the whole body, and
Mm-hmm.
of course the psychosocial aspects as well. So I just felt that was a better fit for me. But certainly I still find those areas very interesting. But that's what's great about medical school. You can really expose yourself to so many different aspects of medicine to find the right fit.
Mm-hmm. Mm-hmm. And so you stayed in the Boston area throughout.
Well, good question. So I was at medical school in New Haven, Connecticut at Yale, which is just a 2-hour drive from Boston. But, there is this Harvard Yale rivalry, which is funny, which really doesn't mean anything. But in those days it did. So it's funny, but they're just 2 hours apart. But I ended up coming back to Boston for internship and residency and fellowship. Actually, I met who is now my husband. We met in college as undergrads, and
Mm-hmm.
he had stayed in Boston himself for medical school and for a PhD program. So I ended up coming back here to Boston so we could be in the same city. So, and we have not left. My husband's from Florida. And so I feel like now he's lived in New England longer than he ever lived in Florida, but he's still is sort of like a Floridian when it comes to the winter. He really detests winter. So I laugh at him about it now because we've been here for so long.
Well, I am in Florida and we call them snowbirds, which you and your husband could become, right? Where,
Right.
when it
That's
gets
right.
cold, come on down to Florida for the Florida winters because we have green winters
It's
mostly.
so true. We do go down to visit his family, and it's just amazing how it is beautiful there all year. And then we come back to these frigid temperatures, and we're like, "What? Why do we live here again?"
So, in your bio, you also are certified in lifestyle medicine. So, could you walk me through what brought you into lifestyle medicine?
Thank you for asking that because that's an area that I'm very excited about. So, I've been an oncologist for a number of years, and I focus on the care of individuals with breast cancer. And it must have been back in honestly 2012, so about 10 years ago, I was seeing patients in Boston at MGH, and I must have seen a flyer somewhere for a lifestyle medicine conference that was being sponsored by Harvard Medical School. And I actually had never heard of lifestyle medicine. I didn't really know what that meant, but the topics at the conference greatly interested me. It was how to encourage patients to exercise, how to write an exercise prescription, the role of healthy diet in preventing cardiovascular disease and type 2 diabetes. Like these were the various topics for the conference. And I felt, wow, these are things I've always been really interested in personally, but I actually don't feel like I have a great understanding and knowledge of these topics to really counsel my patients because as we all know in medical school and residency and even in fellowship, we don't really have a lot of opportunity to dive deep into nutrition and exercise and understand how to really help our patients make these necessary behavior changes that are so important for their health. So I ended up going to that conference and I really found it exciting and could see the relevance to the care of my patients with breast cancer and for cancer survivors in general.
Hmm.
And so after that, I was really inspired to become more knowledgeable about that field and see how I could apply those tools to help my own patients. And that's really how I got introduced to the field from a conference.
Okay, and that conference was back in 2013.
I think it was, yeah, it's hard for me. 2012, 2013. It was a long time ago now that I think about it.
With COVID, I mean, the years are all intertwined. Like, I don't know, but so several years ago,
Exactly.
you attended that conference, and then when did you end up pursuing more education and getting? Are you board certified in lifestyle medicine?
Yeah, great question. So at that time, I realized the power of learning these techniques to help my breast cancer survivor population. Many of our patients, unfortunately, experience weight gain or get deconditioned or have all kinds of side effects from treatment, and they really want their doctor, meaning their oncologist, to help address these concerns. And I felt I didn't have all the tools in my toolkit that I needed to really help my patients who were facing these challenges both during and after cancer treatment. And this is my passion. And I've decided that this is what I want to do. And I want to help my patients optimize their health during and after treatment for cancer and obviously optimize their outcome from cancer. So I met with a colleague, Dr. Beth Frades, who I met at that conference. She's a leader in lifestyle medicine and ended up collaborating with her on a program to help breast cancer survivors learn these important evidence-based tools from lifestyle medicine in order to improve their health. And that was beginning of a wonderful collaboration. We're still working together to this day. And I along the way, I think now here we go. I think it was 2000 2019, I think I took the boards in lifestyle medicine. So there is an opportunity to study the information that's really relevant to that field and really dive deep into the evidence behind the role of. There's actually 6 pillars of lifestyle medicine, which I'm happy to explain, but to dive into that and become board certified. And now I feel like I have a much better understanding and knowledge of the field so I can really apply it to helping my breast cancer survivor population.
Okay, yeah. Could you tell us a little bit more about the 6 pillars of lifestyle medicine?
Sure. I'm happy to do so. So, really, what I like about the field of lifestyle medicine is it's really the mission is to educate and empower our patients with the knowledge about the role of lifestyle interventions in order to optimize health. So it's really teaching the individual patient the tips and tricks that he or she needs in order to live a healthier life and hopefully prevent chronic diseases. And so there's really six pillars that are key, and I'll just go through them. The first one is nutrition, the importance of following a healthy diet. The second one is the important role of physical activity. The third is the important role of sleep. Next is the role of stress management. The fifth one is the importance of social connection and community. And the last one is the importance of avoiding excessive use of risky substances such as alcohol. So there's really these six pillars is what they're referred to. And if you think about each of them, they're so relevant to our overall health as physicians as well. I know this is a great interest of yours. How can we
Hmm.
optimize the well-being for physicians? And as I've really learned more about this field, primarily to help my patients, I realized, wow, this information is also really important to help myself and my
Hmm.
colleagues as we're dealing with all the various stressors we face as physicians. So it's really been a great journey for me to learn more about this field.
That's an excellent point, and that was going to be something I was going to ask you. So I'm very happy that you brought that up because, yes, indeed, the goal of Hope for Med is to really focus on our wellness as healthcare professionals and the way that the pillars of lifestyle medicine go hand in hand with the vision of Hope for Med. And
Mhm.
so, with that being said, on a personal level, have you ever experienced any symptoms of burnout during your career as a physician?
I mean, that's such a, by the way, the fact that you're focused on that area is so important. I'm just so glad that more and more attention is being paid to the role or the unfortunate term physician burnout. Because I think, as we know, certainly over the course of this pandemic, physician burnout has intensified due to all the demands both at work and at home. And I can honestly tell you, I think even now we're in the midst of currently this Omicron surge here in New England, and it's just, I think everyone is feeling beaten down at this point. We're like, we
Hmm.
can't be going through this again. And it's certainly not just the doctors, it's the nurses, it's the medical assistants, it's the people who answer the phones. Like it's just every aspect of healthcare is really suffering right now. And I see it in my colleagues each day. And I sometimes recognize signs of it in myself, and certainly am trying to prevent that in myself, but I'm also finding myself feeling like I need to find strategies to help my colleagues at work too, because this is just this tough time. And I know we're going to get through this particular surge right now. Hopefully, in a few weeks, we'll be through this particular surge, but it's just, it is such a challenging time. And I certainly welcome suggestions from you too for how we can really help ourselves and our colleagues combat signs of burnout.
Hmm. Hmm. With the pillars of lifestyle medicine, when you mentioned nutrition and sleep and stress management, it's funny because when we were going through training, at least for me, what was the motto? Sleep when you can, eat
Yep,
when you can. It wasn't necessarily a priority, right? Was
100%.
let's focus on the patient first and then ourselves and our needs second.
It's so true. And I feel like in many ways that is still the model. I mean, we're so used to that's how we were trained, and we still have that mindset as attendings now that, oh, that's how we did in training. And we just keep chugging at it. And we got to take care of all of our patients, which of course we do. And that's our passion and mission. And that's why we went into medicine. But it is really important that we also pay attention to ourselves. And I feel like now I work with medical students and interns and residents and fellows. And I do feel like this generation of physicians who are going through training, I feel like they do have a better understanding and handle on that. At least I hope so. I think more attention is being paid to it.
So, what do you mean by you feel like they do? Do you have any examples?
Well, I think an obvious one, which I remember, so when I was an intern, I think they were just starting this concept of work hour restrictions. Like,
Hmm.
I'm sure, I don't know when you were in your training, but there was a time when there was no such thing as a work hour
That's
restriction. So I
right.
think in my intern year, they may have instituted the idea of a night float, which I did internal medicine. So it was like a doctor who came on to cover the pagers at night so the person on call could actually get a little bit of sleep. maybe, maybe not, right? And that was a new phenomenon. And it was a hard job for that person in that role, but at least this was a move to like try to help the on-call person get a little bit of sleep. And then over the course of my residency, more and more kind of work hour restrictions were implemented, and eventually it became you could only work 80 hours a week.
Mhm.
I know.
I know 80
But
hours is 2 full-time jobs.
I know, but there was still like pushback. And I know being in the ICU, and in fact, you may be at the end of your quote shift if that really existed, but people still didn't leave. Like if you had a sick patient, you were not going to leave. So that, I mean, and I still, I look back on that time and it was crazy hard and difficult, but I did learn so much about how to care for sick patients during that time. But clearly it wasn't a very healthy approach. So, but now I know they really do very much enforce these work hour restrictions, and people do work shifts as interns and residents. And I'm not so sure about the fellowship, probably as well, but I think it's very much this is part of the culture now. And it certainly was not when I was in the early phases of my training.
One of the interesting things about that, they do have these 80-hour work weeks for when you're in training, but then what about when you graduate?
I know. It's so true. It's absolutely true. There is no, we have to impose our own restrictions. And I can honestly say I am not very good about that and I need to do better.
Yeah, exactly. And so you go through training and you have these restrictions and then you graduate and you make your own schedule. And yes, so many of us, of residents, leave training with so much debt. And then now you're finally making money and then you forget about, oh, maybe I should pace myself, right? Because
Right.
a career in healthcare, it's not a sprint.
Right.
It's a
It's so true.
marathon.
It's so true. It's so true. It is definitely important to learn that lesson. And I think no one really tells us that early on, though, it's something you learn sometimes a little too late. I hate to say it.
Yeah, because I see so many the new graduates now, they are sprinting. They are working
Yeah.
crazy amounts of hours. And I'm like,
Yeah.
you're on the highway to burnout.
Yeah. I know. And it's definitely it's hard. And I think it's I think hard when you're earlier in your career to recognize that. And then sometimes it can just catch up. And I totally hear what you're saying. We need to we need to do better for sure.
hmm And so, right now you're in the midst of the Omicron
Correct.
wave. Here in Florida, it looks like it's calming down a little bit. We'll see. But what have you noticed in terms of some of the challenges that healthcare professionals have been experiencing during this pandemic?
Right. I think certainly, I know it's different in different parts of the country, but certainly here in the Boston area, I mean, first of all, I think we're still all recovering from what happened in the spring of 2020, which was really devastating here. I
Mm-hmm.
mean, I should tell you my story actually. In March of 2020, I'm day one. I do a few weeks a year caring for oncology patients on the inpatient service at Mass General. Okay.
Mm-hmm.
Oncology patients, since I'm an oncologist. So
Mm-hmm.
I'm on day one of my rotation in March of 2020. And that day, there's like all this chaos, and then this major decision is made by the hospital leadership that our oncology floor, where everyone has a private room, is going to be turned into the new COVID unit. Brand new, okay? Because that was just when, unfortunately, this pandemic was really taking off. So I was told all the oncology patients will be moved to other parts of the hospital, and that I'd still be there attending. I just see them in different parts of the hospital. That was the decision at that time. But you knew everything was changing from minute to minute because there
Mm-hmm.
was just so many decisions that needed to be made to manage this very scary crisis situation. That night, I'm walking to my car, and my colleague, who's also a dear friend of mine, who oversees the oncology service, calls me and says, "Actually, Amy, we need you to be the COVID service attending tomorrow. And can you come tomorrow at 5:30 a.m.? We're going to have a special training to learn how to put on the PPE properly. And I will be there with you. We are going to do this together and be the COVID service attendants the first day." Okay. And I'm like walking to my car and I'm like, okay. Because, of course, of course it's okay. This is what we were trained to do. We are
Hmm.
doctors, we care for patients, even in these scary, uncertain times. This is what we do. But I will acknowledge we were all really scared back then. None of us really knew what to expect or how to treat these patients. And so I remember that next morning, 5:30 a.m., I showed up with my friend and colleague. I'm giving her a shout out, Dr. Carrie Reynolds. She's a rock star and an amazing leader. Together, we learned how to do the PPE the right way, which is a science in of itself. And then we were just ready to admit these patients, and because the whole floor had been prepared for this. Also, I want to give a shout out to the oncology nurses. These are trained oncology nurses who are amazing at what they do. And all of a sudden, they're now going to be the nurses on the COVID floor, right? And that was a
Hmm.
big adjustment for them too. So I will say that week, I remember it vividly because it was such a stressful time and so much uncertainty. I will say one of the positive things I remember about it is how everyone really came together to support each other to take on the challenge of caring for these very sick patients and the unknowns. Like we'd be caring for patients and the infectious disease consultant, the pulmonary consultant, the medical student, the intern, the resident, me as the attending, we're all putting our heads together. What is the best way to provide care for these sick patients? Because remember, COVID was new and none of us really knew exactly how to get these patients to feel better and how to prevent the need for intubation, et cetera. So it was a very scary time, but it was pretty amazing how people came together to support one another. So I do think back on that and I'm very proud of what we did that week.
Yeah, I also remember when COVID first started, and I'm in the emergency room, right? So we see these patients
Yeah,
when they
wow.
first walk in the door, and you walk into even to today, or even to this day, you walk into a patient's room, and they can come on with a completely different complaint, like ankle sprain. Oh, by the way, doctor, I developed this cough a
Oof,
couple of days ago. And in the beginning, it was encouraged that we didn't gown up for every single patient, right? We wear
hmm.
PPE for every single patient. You go based off of what their complaint is. And
Right.
so one of the scariest things was, as healthcare professionals, we were exposing ourselves all the time to patients not knowing that they actually had COVID
Oh my
symptoms.
goodness. Yeah.
And many of us were getting sick.
Oh, yeah. That's terrible. But you're absolutely right because we didn't know back then. Also, PPE, we're in the emergency department. We need to preserve what we have for the patients who
Mm-hmm.
are really sick because that was a big concern at that time too.
Mm-hmm. Mm-hmm.
Wow.
And you would think, okay, this is for a short period of time, right?
Right.
We'll get through this, like we get through flu season, and then it'll be done. And lo and behold, here we are, still dealing with waves after waves.
I know. It's really hard to believe. And we're coming up on the 2-year mark, which is pretty unbelievable if you think about it. And it's just been like a nonstop. And so I think it's just been hard on everyone. And again, I really work with such a great team at the cancer centers I work with, and they're all amazing people. But just the need to support each other is apparent more than ever, just
Mm-hmm.
given these ongoing challenges.
Mm-hmm. So, along those lines, what do you think are some strategies that we could use to help support each other and improve well being?
Well, I do have one fun example,
Mm-hmm.
timely example, since you just asked. So, like, I keep emphasizing the importance of supporting one another and checking on colleagues. How are you doing? How can I help you? How can I support you? But having that sense of connection with the people you work with and that sense of community is so important.
Mm-hmm.
And that's also hard to foster because maybe that would develop more at like the holiday party or and things like that. Some fun sort of activities to look forward to, which really we've curtailed greatly, obviously, over the past 2 years. So, what my fun example for you is last night through the Mass General Department of Medicine, we had a trivia night, one of those virtual trivia nights. And I don't know if you've ever done it, it's on Zoom and it is a little silly. You're like, oh, why do I want to get on Zoom again after work for like something? But there were like a lot of, I think it was mostly physicians, all through various departments of medicine on the Zoom last night for a very intense and highly competitive game of trivia. And we had different teams. So I was on a team with some of my colleagues from breast oncology, and our team name was best friends, which is funny, but it is. And I do have to brag that we actually won the trivia
Oh,
competition,
look at
which I
that.
will acknowledge I'm shocked, and I can also state that I did not contribute that much to winning, but I was proud of our team. And I have to say, though, we really had a lot of fun. It sounds silly, like you might say, okay, a virtual trivia night, but I think people really had a lot of fun sort of connecting with, other people that they work with in this kind of interesting and novel venue and competing with other teams. It really actually was fun. Like I would totally do it again and recommend it to other groups that are looking for sort of fun and novel ways to connect if you can't really get together in a large gathering in person right now. Because here in New England, we're not doing that. We're being very careful still, especially with the current surge that we're experiencing.
Hmm. Hmm. And you said that there was a good showing.
Oh my goodness. Yeah. Like I did actually help plan this event, but with all these things, you're like never really sure how many people will sign up. But there's like definitely, I want to say like 75, at least 75 physicians from
Wow.
all different departments at Mass General medical department. So we were the breast oncology team, there were nephrologists, infectious disease, ICU. I mean, there were many creative team names. I can tell you. It was very funny. And even though it was a bunch of doctors, we did know our trivia. Which is also a good thing to know.
So what you're saying is more than just medicine, it sounds like.
Yeah, I think these community building types of events,
Hmm.
which I think honestly, before the pandemic, we all knew those things were important. Like it's always nice to have that barbecue or the holiday party or a hike together or whatever. But I think given how isolated people have been from each other a lot at work or and socially over this difficult time, just realizing that bringing people together to do something fun, even if it's on a screen, like it really does make a big impact. And so I think that was really noticeable last night how much fun everybody had together. And
Hmm.
so I think that community building amongst your team of colleagues is really a good tool to help improve everyone's joy with colleagues at work and hopefully decrease burnout as well.
Yeah, I agree. That's so important. Having a community of shared experiences where you're able to bond together, you're able to have fun together. It
Yes,
makes, especially when you're working in a very stressful life and death environment, it's important to have these outlets of release.
definitely. Definitely. I think it's so important. And I'm just glad we had the opportunity last night.
So, was this the first time you guys did that, or this is something you guys do
It's
frequently?
funny with this particular group. This was the first time I had organized one last year for our cancer center, and that was fun too. I mean, there's all these different organizations that will do these trivia nights, which probably maybe their businesses really took off during the pandemic. So good for them. So those are super fun. I've heard of all kinds of creative things. There's all these things that people do, like virtual wine tastings or chocolate tastings or escape the room, which apparently there's ways you can do that
Virtually.
on virtual. I know, right? Who knew? But I will tell you another anecdote, which is funny, but whatever. It's definitely been fun for me. So I have a Peloton bike, okay? And I know people, not everyone has one, but for those of us who do and who love it within our oncology group at Mass General, many of the women, the ones who do have a Peloton bike, we have group rides. Like we'll meet together on Wednesdays at 6 a.m. Everyone does the same ride from their home, of course, together. And you can, I know it sounds so cheesy, but you can high five people on the screen. And it's just fun that you're doing this with people together, even though they're in their own home. But you're doing it at the same time. You're all exercising and trying to carve out that time to care for yourself. And it actually is really fun. So we've had fun doing things like that too. Again, pre-pandemic, maybe we would not have done that, but I think just looking for creative ways to bring people together. Make the most of it for sure.
Exactly. And really highlighting the fact that as humans, we are social beings.
So true. So true. And I think that's been one of the hardest things of this past 2 years is that,
Hmm.
yeah, we are very social. We're not meant to be quarantined and locked
Hmm.
up in our house and
That's
not
right.
seeing our family. And so I hope we really are able to feel more comfortable with traveling and gathering with our friends and family. I hope that's coming very soon.
And that goes hand in hand with lifestyle medicine in terms of the importance of community.
Definitely. Yes, that social connection piece, which again, just so important and I think made even more apparent just given the challenges of this time. It's
A-
funny, even our Surgeon General, Dr. Vivek Murthy, he actually wrote a book about it's called Together, the
Mhm.
healing power of human connection in a sometimes lonely world. I know that book actually came out, ironically, before the pandemic. I'm actually quickly looking it up to see what year it was published, but I want to say it was, yeah, it came out like, I want to say in the early part of 2020. And it's just, that's what he was researching and writing about before we even knew the predicament we'd be in about the importance of togetherness and community.
Mhm. Mhm. And part of Hope for Med's mission is to really create that community for us as healthcare professionals by doing what we're doing right now as the first step, really talking human to human, not hero to hero, but
Yes,
human to human.
I
Really.
think that's great. That's
Hmm.
such a wonderful thing that you're embarking on and so important for sure.
And you are in leadership, correct?
Yes, yes. So this topic that we're discussing is so important to me as well.
Yeah. And so, as somebody in leadership, what are your thoughts about some changes that leaders in healthcare can make to improve the experience of healthcare providers?
That's a really great question. And definitely it's on my mind right now, especially since it's just a tough time right now. But
Yeah.
I'm glad you're asking that question. And I actually also just read an article 2 days ago, really about focused on women in medicine, where, like, unfortunately, there's recent data that shows that many women are just fed up and there's increased burnout amongst women physicians in particular due to, of course, our dedication to work, but also responsibilities at home. And how can we make the work environment better for all of us, including our female colleagues? And
Hmm.
one thing that I think we have learned from the pandemic is this concept of flexibility. I know you practice emergency medicine, so maybe this idea doesn't apply to you as much, but telemedicine has really taken off during the pandemic. Certainly, I did some of that prior to March of 2020. But when we were really forced to adopt telemedicine and learn how to be innovative in that area, that really has changed the way we practice in many ways. And just to give an example, as a working mom myself, and how telemedicine really helped me just 2 weeks ago. My son, who's 12, unfortunately had COVID and he was fine, but he was sick and needed to be home that whole week and of course taken care of. He couldn't just be home by himself, right? Or
Hmm.
he just had to be home. And I had a very busy clinic schedule, and I was able to switch all of my patients to telemedicine. So I saw all of my cancer patients virtually, and it was able, they were very appreciative because certainly they didn't want to see me if I was exposed to COVID anyway. But they were so appreciative, and I was grateful that I didn't have to, ask all of my colleagues to see all of my patients. So I was able to see my patients, check on my son throughout the day, do this all from home. So that concept of flexibility was really amazing. And as I think about that, over 2 years ago, I would have had to stay home and figure out a plan for each of my patients and who could see them and how I could reschedule everybody. And it would have been even more stressful. So I think that's a really important lesson that I hope we can continue to support going forward.
Hmm. Hmm. And I think another example of flexibility and how quickly things have changed is even the way that we approach treating patients with COVID, right?
Yes,
In the beginning, if they show up hypoxic, they're getting intubated right away, right?
right.
And then very quickly, we realize, oh, well, maybe that's not optimal. And what can we do in real time to prevent intubation or limit intubation? Before
Hmm.
COVID, this is something that would have taken years, but it was
Wow.
a mere months that were like, okay, well, we're not going to intubate them just because they're hypoxic to 50. Let's see if we can, if they're mentating, if they're talking, let's see what we can do in terms of other modalities to prevent intubation. And so I don't think there's
Right.
any turning back in terms of flexibility now that we've seen what we're able to do.
Wow. Yeah, that's really amazing. And it's just another example of how, I mean, none of us wanted to be in this crisis, that's for sure. But
Hmm.
when you are in that kind of mood, that it really does push you and your team and your colleagues to think about how can we think outside the box and maybe make changes that are better for everyone, right? So that's really interesting. Yeah, there are so many examples of that too, I think, over the past 2 years. And obviously, none of us wanted to be in this situation, but perhaps there are some good lessons we're learning.
That silver lining. You have to
Right.
find it,
Right.
right? Because we're
Yeah.
still we're still in the situation, but those are some examples of a little bit of a silver lining from what we've gone
Right.
through.
For sure. For sure. Definitely.
And so now we're in a new year. It's 2022.
Oh my.
So what are some important goals we should strive for in 2022 in your opinion?
Well, that's such a great question too, and something I've been giving a lot of thought to. It's funny, we started 2022, we're like, yay, a new year. And then all of a sudden we're like, Omicron. So I'd say the year's been off to a bit of a rocky start up here, just with all these challenges. That's just life though, right? You have to roll with the punches and there's just uncertainty. And that's part of being resilient, is learning how to navigate these changes and move forward. So yeah, I like that word resilient. I mean, we use it a lot, but I think it's a really good term. That's sort of been something that we've all tried to cultivate over these past 2 years. But when you ask that question, I've never been one to be really into New Year's resolutions. I certainly am obviously a big believer in goal setting and setting goals in various aspects of my life. But I always am like, there's nothing really different about January 1st versus February 12th. You can set goals at any time. So
Just
one
another
book,
day,
well, one
right?
goal what were you going to say?
I said just another day, right?
I know. One book that was recently recommended to me, though, and actually by a few separate people that don't even know each other, but now it makes me want to read it even more. So I actually just started it. It's called 4,000 Weeks Time Management for Mortals by Oliver Berkerman. And anyway, 4,000 weeks. So if we are fortunate to live to age 80, that is how many weeks we have in our life, which is crazy to comprehend that. I'm already telling my kids, I only have 1,500 more weeks. And they're looking at me like I'm crazy. But, we have this time, and how do we want to use it best and to help others serve our own purpose and be fulfilled? And I think that's what I'm trying to think. I mean, those are big questions, but that's what I'm trying to focus on right now. Like, what do I want to do? What is going to, obviously, my family is my number one priority, but of course, caring for my patients and being fulfilled at work and making an impact and doing some good in the world. Those are all things that are important to me, and trying to think about how to best do that with my time.
All right. Well, that's really profound because it's true. Our life, the time we have on this earth is very finite.
Yes. Yes, for sure. And I think that's what this book really talks about. I haven't gotten far enough to give you more insights.
What do they say? The only guarantee in life is death and taxes, right?
Oh, yes.
For most of us, taxes, no. But anyhow, but given the amount of time that you have here, how do you use it to the utmost? And as healthcare professionals, I mean, this is a field where we have the potential to have such a profound effect on others.
For sure. Yes, absolutely.
However, we must never lose sight of ourselves.
Agree.
And so really having that practice, that wellness practice where we are central to it and that our health is optimized will allow us to really continue giving our best to everyone else.
I definitely agree. And I think that's why it's wonderful that you're making that your mission as well. I think it's just so important. We don't want to lose sight of that.
And so with that being said, I know that you recently co-authored a book.
Yes, thank you for asking. Maybe I told you. But yes, that was something super exciting to come out of the pandemic. So another thing that was, I guess, a good thing, of course. It's the first time I've co-authored a book, and it was really exciting to collaborate with my colleagues, Dr. Beth Frades and Dr. Michelle Tollefson, to produce this book. And I'm so excited about it and hope there's more in my future. But yeah, I learned a lot by writing the book. I mean, it's a process for sure. So it's called Paving the Path to Wellness, which the title really came from Dr. Frades, who started a program with this name to help stroke survivors. Just the power of conferences and connections. I met her at that lifestyle medicine conference that we spoke about at the beginning of this podcast. And that's who I've been collaborating with to develop this Paving the Path to Wellness program for breast cancer survivors. And so we decided to collaborate and write a workbook that people could use as they go through the program. And so it really was a great learning experience. And I'm really proud of how it came out. In fact, I just picked up a copy off my dining room table to look at just because it's nice to hold it in my hand and actually look at it and feel proud. So yeah, so that was another good thing to come out of this past 2 years.
Yeah, look, all these silver linings we're coming up with during this
Yes.
conversation. And so if my listener wanted to find that book or purchase that book, how could they do so?
Great question. So it is now on Amazon. So the publisher is actually called Healthy Learning. So it's on the publisher's website too, but it is now on Amazon. It's called Paving the Path to Wellness Workbook. And one can order it there. So I'm excited about that for sure.
All right, Dr. Comander. So we are nearing the end of our time together. Do you have any words of wisdom that you would like to share with my listener?
Well, first, I just want to thank you for the opportunity to be a guest on your podcast. And thank you for the important work you're doing to help us all live better and more fulfilling lives. So thank you, thank you, thank you. I do actually have a quote taped to my computer here that I think you're going to like. So I'm going to actually read it to you.
Okay.
I will add that I have a calendar, and sometimes when there's a quote I really like, I rip it off and just keep it so I can look at it again. So this is the quote: "You are a limited edition. Take care of yourself." And I think that's a message we all need to hear sometimes.
Yeah. Who says a doc can't rap? DOCTORJB. The greatest doctor to ever touch the mic. The greatest podcast ever broadcasted or pre-recorded. Come learn some. Each one teach one. I'm done.